Good morning. This is Dr. Beck. It is August the 23rd of 2021. I can't believe it, but it is, and it's Monday morning, and we're doing okay this morning, and my prayer is that you are too. We're open for business. We want to hear from you if you got any ailments going on so we can see and get you seen. So I want to talk to you about some of the procedural things here in the office so people understand things better. And the front desk asked me to mention this on the video this morning. It is about confirming appointments and no-shows. We have an automated system set up so to confirm your appointment, and it's both there as a reminder to you, but also a reinforcement to us that you're coming in so that we can do all the preliminary work that we need to do before you get here to make sure we've got all the information we're looking for during your visit, and we're prepared to talk to you and discuss your issues. We actually do this. We do preliminary work before you get in here. The main thing is we're having more and more trouble getting people into regular appointments, and that is very much disrupted by people who are no-showing or counseling. If you cancel your appointment, a day ahead, we're good with that, okay? But if you're just absolutely no-showing, we just ask you to be respectful from that standpoint as we struggle more and more to get people seen with regular appointment slots. Now, our obligation is to you. We have the work-in slot every day. So if you're a patient of mine and you've got an acute problem going on, we'll see you on that day. But that day, that work-in slot is at 4 o'clock, and we sometimes 3 based on what the situation is. But we reserve that spot. Nobody is assigned to that spot till the day of the visits because we want to keep it open and keep it available for our current patients. So that's how we do things here. It's just the working slot we're keeping open like it is, but let's say you need a 2-week follow-up or 3-week follow-up. We're having a hard time finding slots to put people in, okay? And that's a blessing, okay, but it's also something we've got to work around and make sure we are keeping our promise to you and delivering the best health care we can. Also with that, we're having to put on a waiting list for new patients to come in, okay? Because my obligation to you guys is to see you every day if you need to be seen, but for new patients, we don't have that obligation, so we have to find slots for them in the near future, and I think we're 2 or 3 weeks out now, and we're going to keep accepting new patients for a while, but as that gets longer, it's going to be more and more difficult for people to get into the practice. But if you're already in and you're already signed up for us, we're going to keep our promises to you. So just be thoughtful and helpful with that if you can. I appreciate it in advance. As far as COVID-19 goes, there's 1,697 cases reported today, but I want to talk about a few things. First of all, I have heard reports that a lot of hospitals are full and overwhelmed in the region, like Northeast Georgia, and I don't have a lot of technical data on that, but I'm just hearing from nurses and family of nurses, it's hearsay, that they are having to put up their portable hospital tents again and things like that. And I did see some news reports on it from one of the local news providers. Okay, so it's very important for us, if you're at high risk, to have that vaccination, okay? And if you're not vaccinated or you're high risk or either or both, avoidance is the number one mechanism, okay? And when I say avoidance, I mean hand sanitizer, wearing a mask, staying out of public if necessary, okay? With that being said, I had a patient or a potential patient to me asked me the other day, I'm not vaccinated, will you see me, okay, in the office, okay? And the answer is, I'm not going to force anybody to get a vaccination. I'm not going to force you to get a vaccination so that you continue to be my patient. That's not going to happen. I have not forced my employees to get vaccinated. I've been vaccinated, and everybody in my office who chose to be vaccinated I helped them get vaccinated. Okay, just like with a patient, if you want to get vaccinated, I'll tell you where to go. But as far as me not seeing a patient or not taking care of somebody because they're not vaccinated, that's not going to happen in my lifetime for me in this office. Okay, and I've even saw a news report where some doctors were doing that. I'm not going to do that. That's craziness. I do think it's your choice. I think it's an individualized choice based on your situation and your whole history and everything else. And I'll discuss your individualized situation with you in the exam room if you'd like to talk about that, because that would be a service that I would provide that would be legitimate. Let's discuss this. It has to be done in an office visit though, so I can dig into everything with you. And I do recommend the vaccination, particularly for people who are at high risk. Okay, but I'm not going to call anybody because they have or have not been vaccinated. Certainly, if you're ill, if you're sick, if you've got an upper respiratory infection, we're going to limit your access to the office. Okay, with your help. But we're going to also see you with video and make sure you're taken care of, and that's the way we want to do it. Alrighty, Place of Hope is doing wonderful, and we're always looking for more brick buyers. And I'll find out earlier this week how many bricks have been sold, but I've seen some of the list, and I know a lot of you people, and I really appreciate it. Alrighty, everybody have a wonderful day. Call us if you need us. Thank you.